Good afternoon, everyone, and good afternoon, Virginia. I come to you today as our country passes a grim milestone of losing 400,000 Americans to the coronavirus. That is a staggering loss. It's so large, it's hard to actually see it in your mind, to process how big it is. You could fill up both UK and U of L Stadium 3.25 times, and that would represent the number of lives, the number of people that we've lost in America. Imagine that. The sea of people you would see at any of those games, all gone, both stadiums, 3.5 times over. That is the magnitude of our loss. Here in Kentucky, we have fared better, but have now lost over 3,100 of our friends and family members and neighbors. We'll be providing details later this week about how we're going to memorialize crossing our own difficult milestone and how we ensure that even this late in the pandemic, we continue to honor those that are gone, that we continue to support families, and that we continue to remind ourselves, based on that grief and that staggering loss, that we have to continue to fight day in and day out. While this virus is dangerous, and maybe this is the most dangerous time we've been in during this pandemic, there is a bright spot, a light at the end of the tunnel, and that is 2 highly effective vaccines that are going into people's arms across America and really across the world right now. And here in Kentucky, we are proving that we can do it better than just about anyone. Last week, a major news network ranked Kentucky in the top 10 states for vaccination, and we are only getting better. I want to show you the stair-stepper chart that we used last week that shows vaccinations. I'm proud to report that this last week, we vaccinated significantly more people than we received doses of vaccine. We have increased significantly every single week our ability to provide vaccinations and to get it into people's arms really quickly. And that's some pride that we are vaccinating at a faster pace than we actually get vaccine. That's exciting. But it highlights what the very real problem that is going to drive this country for the coming months. And it's only one major problem, and that's supply. Let me show you 2 numbers. 83,212 are the number of vaccinations we gave first or second dose last week. That is our capacity that is growing every day. How many we can do in a week, and we're only getting better. And remember, we're building the infrastructure right now to provide even more. That second number, 56,175, that's what we just learned we're going to get next week. So the supply that we're going to get next week is already 30,000 people, 30,000 doses underneath our ability of what we can put in someone's arm in just a 7-day span. Supply is going to be our major issue in the United States, and it's why we're going to have patience. And supply right now is what's driving most of the things you see. It's why in the Louisville area, they had to cut off appointments for people over 70 because huge demand, a lot less supply. It's why that some areas have had vaccine and have been able to get into 1B or maybe even 1C, and now we're getting a little bit less. That's an issue of supply. It's why right now we can't guarantee that every pharmacy across the across Kentucky gets vaccine because we don't have enough supply. And so that's why today I formally requested from Operation Warp Speed that the federal government double the amount of vaccine we receive every week. We are proving that we can get it out there. We are proving that we are efficient. We are proving that we can get it into people's arms. But right now, and moving into the future, we're going to be sitting around with entire days where we've already run out of vaccine waiting to get more from the federal government. This is our major challenge moving forward. And to so many out there who are anxious, and I understand, anxious about when they will get the vaccine, I promise you, we are moving as fast as we can given the amount that we receive from the federal government. But we cannot give more doses out once we run out of what had built up than we actually have, than we actually receive to provide. So know that we're getting better and better at this. And we're going to be able to vaccinate our population as fast as we can get that vaccine. And our only limitation is going to be supply. That's where we're at. And we have, a lot more that we have in the works. Again, building the infrastructure to do even more. So good news in our ability to provide the vaccine, concerning news in the supply that's actually coming to us. A couple things can change that. Ramp up in manufacturing, the federal government getting more access to more of these to send out, another vaccine being approved and getting out there, whether it's Johnson & Johnson or AstraZeneca, all of those things could provide us more supply, which again, we're ready for right now with every one of our providers who right now is vaccinating individuals, having the capacity to do more. And I'm proud of all those providers, and I'm proud of everybody who wants to be one. And now hopefully we've set out exactly what our challenge is, and the federal government's challenge is moving forward. Now, to talk a little bit more about our two programs, we're going to have Dr. Stack talk about our state-run program, and then we're going to have Adam Mather again talk about the federal long-term care program, where the vast majority of unused doses that they are going to go into people's arms, they just haven't yet, are because of our contractual requirement to go ahead and provide them to Walgreens and CVS. They go directly from the federal government, regardless of their pace. That's what the federal government and those groups agreed on in that contract. So first, let's go over to Dr. Stack.
Thank you very much, Governor Beshear. And the governor's already given you details on the numbers of vaccine and the situations. I'm going to emphasize a few things and then give a few additional updates. So as the governor has said, this is all about volume. I'm confident that in Kentucky, if we had unlimited vaccine, we could easily immunize 250,000 people a week, if not more, today, if we had enough vaccine. We get about 54,000 doses a week, approximately, and that's all we can do. So thank you to all the vaccine sites who are already out there vaccinating. We appreciate what you're doing. Thank you to the many, 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 many more who want to vaccinate. There's almost 1,500 locations who want to vaccinate in Kentucky and have started the enrollment process to do so. We just don't have enough vaccine. So thank you for going through the process and getting set up. As soon as the quantities start to increase, we'll begin to find ways to make vaccine available to more locations. And we look forward to the time when everybody can order it just like a regular medicine and have access to it. Until then, a lot of the frustration that's happening is because people who want to get vaccinated don't know where to go to get it, don't know where to sign up even to wait. Places that want to vaccinate don't know if they'll be able to get vaccine, if they'll get it, how much they'll get it, and if they'll get it regularly. So this is a market dysfunction. So we need to build a system where people who want to get vaccinated can identify themselves and sign up and then get themselves in queue to do so. And we also have to provide a system where the people who are vaccinators know they'll get a stable supply of vaccine going forward so they can plan accordingly And those are the steps we announced last week we are beginning. We announced the partnership with Kroger to help with regional higher volume locations that will scale as we get more vaccine. That's only part of the plan, though. We'll continue to work with hospitals who have already identified themselves and are partnering with us to provide hubs for their local communities. We are going to continue to add locations. We'll partner with additional vaccinators, additional hospitals, or other locations to fill in the gaps that we have on our coverage map at present. And in this case, our goal is to be appreciative for all those who want to vaccinate, but our first priority is not the satisfaction of the vaccinators, it's the satisfaction of the citizens in Kentucky who seek to have access to the vaccine. So this month, all along, January 2021, was envisioned, at least as I saw it, as a month of bringing order to chaos as we try to find rational ways to align vaccine with people who want to be vaccinated. And I'm confident we're taking those steps. I'm very grateful to the governor for giving me a partner in Secretary Jim Gray and the others that he has brought together as part of a larger team. And I'm confident you'll see in the weeks ahead that we have a system that will be stable and clear and more consistent, and that is able to absorb excess vaccine as it comes into the state, hopefully more of Moderna and Pfizer, but also hopefully a third and possibly even a fourth approved vaccine so that we can reach out to others and do so as quickly and seamlessly as possible so the people of Kentucky have access to it as quickly as we can deliver it. I'm very grateful to see that it looks like Kentucky has been one of the more rapid states to deploy vaccine. We don't rest on our laurels, and we know that things are complicated and ever-changing. And please know we're doing everything we can to do this as efficiently as possible. To that end, I have one last part on the vaccine program. In phase 1B, our first responders and K through 12 educational personnel, and also people who are 70 and over. Those are three very different populations. The first responders have been vaccinated and are still being vaccinated. That's a much smaller population. The educational community is approximately 85,000 individuals, give or take a little bit. And that program is unfolding now as we speak. We probably have at least 10 counties who are finished with their first doses, and more counties that are being vaccinated this week. Over the next 3 weeks, it is our goal to have completed by the end of the first week of February, essentially all of the K through 12 personnel who accepted that offer by the end of the first week of February, if not the very first few days of the next week, as we catch stragglers. And then we are beginning to have already the population 70 and older who are having access, but it's not as good as it needs to be. Please know that we know that, and I'm sorry. We need more vaccine. And as we enter the month of February, the focus is going to be fully on reaching persons 70 and older, as the other communities in 1B have been addressed because they were smaller and more defined. And please know that is our next priority. To make sure that gets done. And then concurrent with that, because we've already identified that there are times when scheduling and various other considerations make it difficult, people in 1C will begin to be able to get in line after the people in 1B if they have excess slots or time or need to use their 90% of their vaccine that week. The goal is to use it all as quick as it comes in the state. So Governor Beshear, thank you for the opportunity again to serve. I'm confident that we are going to get this out as quickly as we can to the people of Kentucky. And though I know it doesn't come fast enough, please keep perspective. It's very important. The fact that we have 2 vaccines this effective less than a year after this pandemic began is a modern medical miracle. The fact that we have the problem of insufficient quantities to be frustrated by is still, even so, when you place it in perspective, a blessing, and it is something we should be grateful for that we are able to begin deploying it this quickly. So thank you very much, and we'll keep at work for the people of Kentucky. Back to you, Governor Beshear.
All right, we'll now go to Adam Mather from the Cabinet for Health and Family Services. on the federal government's long-term care program with Walgreens and CVS. Adam?
Long-term care vaccination program. Some brighter news. All SNFs, which is the highest level of long-term care in Kentucky, they've received their first clinic and are starting on the second clinics as we speak. So that is great news. Additionally, approximately 2/3 of assisted living facilities have had their first clinic as well. As the governor mentioned before, this is a federally run program. And so there were requirements around the allocation with our federal partners, CVS and Walgreens. And so right now we're currently working with them to more clearly identify additional allocations and doses that were delivered directly to our federal partners. And that way we can ensure that those doses will quickly get in the arms, be reallocated and quickly get in the arms of all Kentuckians. Thank you for allowing me the opportunity, Governor, to work on this project, and I'll turn it back over to you.
All right, Adam used a little bit of lingo there. So let me make sure everybody has the information. At this point, all skilled nursing facilities across Kentucky, residents and staff have been offered, and we hope all of them took, but have been offered their first shot with either Walgreens or CVS coming on site. This is the highest level of care, those most at risk for this virus. 2/3 of assisted living, which is one step down, folks that need some help, but aren't in that skilled nursing level of need, have had their first vaccine administration, and will be getting that last third, and then everyone's second shots. What we're seeing now is the amount that we were required to provide to CVS and Walgreens under the contract. We believe it's going to be more than they need for the first and second shot. So one of the things that we are doing right now is going back to them to make that calculation so we can try to make more available to the to 1B right now to individuals not in those facilities over 70, provided that we can make that calculation accurately. Those are doses then that should get out in people's arms, and that would increase Kentucky's pace even more. Okay, some good news in the healthcare area. Today, I announced that Kentucky hospitals are going to receive an additional $800 million to $1 billion annually to help advance the quality of care of Medicaid members and to provide a stable base for hospitals that will extend beyond the financial challenges of the COVID-19 pandemic. With over 1/3 of Kentucky's population enrolled in Medicaid, the payments are critical to building a better Kentucky by ensuring equal access to quality care in the Commonwealth. Healthcare is a basic human right, and providing healthcare, especially to so many in need, require us to have a strong healthcare system, strong hospital system that employ so many individuals across Kentucky. In our hospital and medical personnel, I mean, they are holding the line and have been doing so since March. I mean, if we think about being at war with COVID, and we are, I mean, wave after wave of the enemy has been coming at us, unrelenting, day in and day out for almost 11 months. These hospital personnel, other medical personnel have held the line each and every moment, each and every day to try to protect Kentuckians and Americans from a deadly enemy. Our hospitals need additional support to ensure that they can continue to meet the needs of Kentuckians, to save lives now, but ultimately to make people healthier in the future. We know this is one of our challenges as Kentuckians. We know it's a challenge to our daily lives, being in the top 4 or 5 and heart disease, lung cancer, and diabetes. We know it's a workforce issue. But right now, we're developing programs in the midst of a pandemic that can do something about that provide an unprecedented level of resources to those that can help get us healthier. And I'm pretty excited that we can provide this additional help at a time where they're proven what just a little bit of resources, what they can do with it. Right now, it's saving lives, and I think in the future it's going to be improving lives. So now I'm going to introduce the Cabinet for Health and Family Services Secretary Eric Friedlander to discuss the Cabinet receiving approval from the U.S. Centers for Medicaid and Medicaid Services on the new directed payment initiative that increases inpatient Medicaid payments for Kentucky hospitals, and he is going to explain exactly what that means.
Thank you, Governor. You've explained it very well, and there are not a lot of times I get really excited about things, but I'm very excited about this. This is an opportunity for Kentucky to really take a step forward in coverage for our fellow Kentuckians, and for improving quality, and for making sure that we're paying hospitals what we should. So this opportunity allows us to leverage what we've done in terms of working with Kentucky Hospital Association and all our hospitals to provide us the opportunity to pay what is called the average commercial rate. And I don't mean to get too jargony on folks, but this is normally what private insurers would pay for healthcare in hospitals. Medicaid is always well below that. So this gives us the opportunity to pay the hospitals what they would normally receive for anybody that would be coming in their hospitals that would be under private insurance. This is a great day for the hospitals and for us. It's also a program that addresses quality. And so I think we will see, as we look at how we provide services across the Commonwealth by our hospitals to our Medicaid population, and actually to all patients that will be coming into our hospitals, we will be able to support the best quality possible. And this would not be possible without the great partnership that we have with the Kentucky Hospital Association and hospitals across the Commonwealth. Governor, you said it very well. Our response to COVID-19, our response to this pandemic has been strengthened with our great partnership with the Kentucky Hospital Association and with all hospitals across the Commonwealth. Dr. Steck, I think, knows every CEO of every hospital in Kentucky. He's probably been on the phone with them a couple of times. We meet with Nancy Galvani on the phone at least weekly, usually more often than that. So Nancy Galvani, who is the president of the Kentucky Hospital Association, will be following me. I cannot thank Nancy enough for her leadership, for her partnership, for her collaborative spirit. We've made a difference. And you say it all the time. We get through this and we get through this together. This is a tremendous example of how we do that. So now it is my great honor to introduce Nancy Galvani, the president of the Kentucky Hospital Association. Nancy?
Eric and Governor Beshear, we definitely appreciate the excellent partnership with your administration on so many levels. On behalf of our members, the Kentucky Hospital Association is excited and thrilled that CMS has approved this new directed payment program. The partnership between your administration, the Cabinet for Health and Family Services, and Kentucky's hospitals has made this application successful. And we are very grateful to Cabinet Secretary Eric Friedlander and your office for all of your support. Improved reimbursement for Kentucky's hospitals is vital for their survival. Medicaid, as Eric has mentioned, does not cover the full cost of caring for the patients we serve. Every year, our state's hospitals see a shortfall from treating Medicaid patients. And with more than a third of the state's population covered by Medicaid, this is an unsustainable model. So the change in this reimbursement model coming from CMS will go a long way to eliminating the disparity between reimbursement and costs. Kentucky citizens have access to quality care at some of the lowest prices in the country and lower than our surrounding states. Our hospitals are proud to offer high quality care close to home, and this program that CMS has approved will help them continue to meet that goal. This enhanced funding will be crucial to our hospitals for upgrading equipment, for retaining their employees, and covering the costs of providing high quality care for their communities. This could mean the difference between keeping the lights on and closing the doors to many of our hospitals across the state. And as was mentioned, this will also provide an avenue to increase quality, which is an important component of this program. Kentucky's hospitals continually work to improve the quality of the care they deliver, and we look forward to promoting this as we will work with the Cabinet to develop specific quality measures for this program. The next step to update this program is passage of House Bill 183, and we are pleased to be working with Representative Brandon Reed, the sponsor of the bill, our partners in the General Assembly, and our partners in your administration. This is certainly a fantastic win for everyone in our state, and I want to thank you so much for the opportunity to be here today. Thank you.
Well, thank you to Nancy and everybody out there working on a COVID wing, working in the ER, helping people with rehabilitation after they're no longer infectious but still suffering. Thank you. Thank you. We knew what you did was amazing. Right now, it's nothing short of heroic. And let's make sure one of the things that we take out of this, that we don't go back to an old normal, is continuing to work to improve people's health day in and day out. Our biggest weakness in facing this virus is how, as a people, we're not as healthy as we need to be here in Kentucky. This is an opportunity to address that, and this is really exciting. With all of the jobs that our hospitals and healthcare system provide, this is a real investment that those types of facilities haven't always received. For instance, they're can't get economic development incentives in creating new jobs that other types of industries can. So this is really good news. All right, let's go into our COVID report, and we'll do what we normally do on Monday, show you the stair-stepper chart, which I think gives you an idea of trends. So if we can put that up. All right, remember at your at the far end where we got our first set of cases, you see down there the first wave, which now looks fairly small, but remember we took extraordinary steps to keep it that way. And then as you move to about the middle, you see the summer surge. And then as you get further to the right, you see the third wave, which is significant, more aggressively spreading than ever before. But the steps that we took, difficult steps, I won't say they're unpopular steps. We'll show you new polling as of just a couple weeks ago, where there's a lot of support for doing what it takes to beat this virus and save people's lives. But we took, for some small businesses, what would be painful steps to stop that third wave. And then we started seeing a real decrease. And then the post-holiday jump. We believe fueled by private gatherings. And what we didn't know, especially 2 weeks ago where we hit that all-time highest week, was would that establish where we were, or did people go back to keeping their home gatherings small and following all the rules? Well, this last week at least provides a little bit of good news or hope that is indeed the case, and that post-holiday surge may not be a new normal in the fight against this virus. Certainly today, when we get to it, is less than last week. Strangely, it's more than 2 weeks ago, the highest week. We just ended up getting tattooed in every other day of that week, but it's even less than 3 weeks ago, that third bar from the end that you see. And we'll watch the rest of this week where those cases are going. If it is indeed the case that that's popping back down, while we may have had a couple weeks of not following the rules, it would indicate that people are working and trying really hard, and for that, we're grateful. It's other than early on in the pandemic, it's startling to look at the test positivity and how much it looks like our stair-stepper chart. And so if we can put that up, you know how we have the first wave, though, certainly in positivity that's larger, but you can see the second wave and the 3rd, and even in on this graph, this last week being lower than the week before. I say all this because I want to acknowledge, if this is the case, that Kentuckians are doing a good job, but everything is fragile. With an aggressively spreaded virus that may have indeed mutated to be more aggressive, every moment that we let our guard down, we can have a whole new wave. That's the way this works. We never back down, never get tired. But I think that we are showing, even with way too many cases right now, that we have the knowledge with the right rules and regulations that we got to keep in place to battle even where we are right now. All right, today's COVID report, we're reporting 2,250 new positive cases of COVID-19. Again, that's lower than last week and lower than the week of December 28th. It brings our total number of cases to 330,907. Today, we have a positivity rate of 11.55%. That's the second lowest since January 5th. And it's all been within a couple of points. This is still a lot higher than we would like to be, but it's good to see that once it hit 12, it did not continue to escalate like it did in so many other states. Currently hospitalized, 1,633. This is up a little. That often happens after a weekend, and here a holiday weekend. Currently in the ICU, 442. That's also up a little bit. Currently on a ventilator, 208. I think that is flat from yesterday. We have now administered almost 3.8 million tests across the Commonwealth, 3,798,678. New cases by can be found on our website, kycovid19.ky.gov. When we look at deaths, I mean, we're averaging far too many each and every day, and that's because of that real spike in the third wave that we are still feeling the ramifications of. So today we're reporting 27 new deaths that bring us to 3,194. Again, the list can be found on kycovid19.ky.gov. I don't appear to have that listing in my notes. If somebody can grab that for me and bring it in, we will read it the same way that we always do. K through 12, last week, 1,214 students tested positive. Those were new cases. 500 staff tested positive. Last week, we had 4,031 students quarantined and 733 staff. And that's with all schools not reporting in, which they need to do. It's their obligation during this pandemic. And what I'd ask is for people to understand, if a school district now, and following our new rules, looks at this type of data and says, we just can't do it this week. When you have 1,214 students across Kentucky in 1 week testing positive, please understand that's them trying to make the most responsible decision that they can. Now, these 3,100 plus folks that we've lost, again, aren't simply names and ages and counties. They're people. So today we're sharing the story of Josephine Holcamp of Louisville, Kentucky, who passed away January 5th from COVID-19. Her granddaughter Shannon reached out to us, sharing how her grandmother was diagnosed with COVID on December 15th while living in a long-term care facility. She was a fighter, but unfortunately she did not survive the virus, passing away at age 97. Shannon told stories about how her grandmother cared for her daily after school and how she was always amazed by the love between her grandmother and her grandfather. Even in the low mundane parts of the day, love was always there. Look at them. They were married for 53 years, and the family finds comfort knowing that they are now reunited. Josephine lived a long and amazing life full of travel, quilting, and cooking. She always gave to others, volunteering her time with both her church and with Little Sisters of the Poor for 25 years. But more than anything, she loved being with her family. Josephine had 9 children, more than 20 grandchildren, and 30 great-grandchildren. She always made sure to say, "I love you," every day, and the family never left without a hug and a kiss. Shannon and their family ask us to mask up, not for ourselves, if not for ourselves, for those around us. In honor of Josephine, let's spread love by doing our part to keep those like her safe. Today, I mask up for Josephine, an amazing Kentuckian, and to your family, we are so sorry about this loss. We grieve with you. What a special, amazing individual. What a loss, I know, for you, but also for the Commonwealth. All right. The 27 individuals that we've lost today include a 64-year-old woman from Allen County, an 85-year-old man from Anderson County, a 59-year-old man from Boyle County, and a 71-year-old man from Boyle County, a 66-year-old woman from Caldwell, a 66-year-old man from Clay, an 81-year-old man, and a 93-year-old man, both from Crittenden County, a number from Davis County, a 73-year-old woman, a 77-year-old woman, an 81-year-old woman, an 87-year-old woman, an 88-year-old woman, a 65-year-old man, a 90-year-old man, and a 91-year-old man. Remember that these come in at different times. I'm looking at the dates. They range just from mid-December through the 4th. 94-year-old woman from Fayette County lost. 75-year-old man from Harlan. 56-year-old man from Henderson. An 85-year-old man from McCreary County. A 91-year-old woman from Monroe. A 92-year-old woman from Monroe. 2 men from Monroe. 66-year-old male and a 75-year-old male. 2 males from Ohio County have been lost. 77 and 81, and a 63-year-old man from Trigg County. Losing 27 people or so a day. It doesn't take long before we all know, not 1, not 2. I know I'm past 3. Incredible, amazing folks that we have lost during this virus. Let's try harder. Even if we're trying really hard, let's try harder. I mean, with the level of loss, even if you look and see other people aren't necessarily, some people, it's a small group, aren't doing their part. And that's not how we should judge ourselves. It ought to be whether we're doing the right thing because it's the right thing each and every day. And I know I get frustrated, and you all probably do too, but we just had celebration of Dr. King yesterday, and he paraphrased and say it's always the right time to do the right thing. And I'm talking about character, especially when it's hard. So let's continue to do an even better job, to set goals of protecting people every single day. Now is probably the only time in my lifetime where every Kentuckian has an opportunity to be a hero to those around us. It's also the only time in my lifetime that folks, merely by not thinking of other people, can cause them real harm without having to see it and to feel it. So let's do the right things. Long-term care today, 101 new residents, 62 new staff members, 47 new deaths attributable to folks in long-term care. Now over 314 facilities that have had at least one case. All right. Final piece that I'm going to talk about today is I've issued a series of vetoes of certain legislation that was passed in early January by the General Assembly. Passing a veto is my constitutional obligation. Issuing a veto is my constitutional obligation as governor. And it's my job to issue those vetoes with veto statements when I don't think something's right, when I don't think something is constitutional, when I think something will harm Kentuckians. When the legislature returns, they'll have an opportunity to potentially override these vetoes. I did hear from at least one leader through the press that they wanted, before considering vetoes, to talk and see if there's a compromise. I'll be sending a letter tomorrow or at the latest the next day on some certain areas that I think that might be possible. But let me go through a couple of steps to talk about why I've issued the 3 bills that would restrict the authority of the governor to respond in times of emergency, and specifically would hamper what have been comparatively successful steps we've taken in Kentucky. Let me go through it. First, it's important to recognize that right now, and this is a poll that was conducted in the last couple weeks of all 50 states, but specifically had Kentuckians, the actions we've taken, even though painful, have the support of the vast majority of Kentuckians. Listen, everything we're dealing with right now, the divisiveness, I can't tell you anything else that over 73% or up to 86% of people agree on. And what this says is no matter which party you're in, no matter who you voted for president, people of Kentucky support the ability to take the steps necessary to protect us and support the steps that have generated the most criticism from some lawmakers that they claim have pushed them to take these steps. So according to, again, this is the consortium that has been doing this just about every month, 86% of Kentuckians support our request, or indeed our mandate during a certain period of time, about those private gatherings in your home and the limitations to the number of people. I've heard some people say you shouldn't be telling people how many people to have inside their homes. Well, look at the post-holiday bump. We can tell you that it spreads, and it spread significantly from those. 86% of Kentuckians want us to continue to have the ability to do that. 78% of Kentuckians support when we had to limit restaurants to carry out only. Now, we're not doing that right now. We have a capacity limit. But look at that. Again, this is one of the grounds, and that's specifically been written into some of the bills. But 78% of Kentuckians saying you got to do this when the virus is that bad, that we want to support through carry out, but we want to make sure that we are following a practice that 3 straight times blunted exponential increase in this virus. 73% supported the steps that we took, and really only for a series of weeks when the spread was growing at such a rapid pace about in-class learning, asking and requiring for a short period for schools to go remotely. Again, one of the impetuses behind passing the bills that I've had to veto were claims that there wasn't the support behind this. This is massive support for the steps we're taking from the people of Kentucky. And I think what you can reasonably infer is that this amount would disagree with preventing us from taking these steps at a time the virus is spreading so quickly. So point 1, Kentuckians support the steps we've taken that these bills that I vetoed would curtail us from taking. Step 2 is by taking these steps, we've been successful. I want to show you this chart. This is deaths normalized by population. This is if us, and this is every neighboring state, had the same population. How have we done? Look at Illinois having the most deaths per capita. But then look at every other one of our neighbors. All of them have suffered more compared to Kentucky. We have done a better job at keeping our people alive. That's what we're talking about. How well have we done at keeping people alive compared to our neighbors? The answer is a better job than all of them. And what that's taken is being willing to take steps maybe others wouldn't if they were worried about the popularity, or maybe they were worried about the reaction of their own state legislatures. I tried to make my decisions based on what would protect the most people while balancing economic interests. But look at that. This would now hamper our ability to make the decisions that have us having less people die per capita than all of our neighbors. Do any of us want to see this trend reversed? Do any of us want to see our line starting to go up steeper than that? We've done a better job than all of our neighboring states at keeping our people alive. Let's not backtrack on that, especially now that we are vaccinating people, in fact, vaccinating them at a rate higher than the supply we're getting. Let's show the stair-stepper chart again, overall on number of cases. Being successful, you see the blunting of the three surges that we've had, and now we're dealing with a post-holiday bump that we hope has been blunted as well. What would be restricted here are the tools that have helped us stop exponential increase that have devastated other states. So if we're going to have a fourth increase, which we may have a fourth surge before everybody gets vaccinated, do we want to be able to stop it or not? I certainly think we do, and we know how to. And the third, if you'll show, is the vaccine chart. Listen, we're right now becoming more and more successful than almost every other state at vaccinating people quickly. We just need more time. So we're more successful than other states at keeping people alive. We're vaccinating people at a faster rate, yet we're going to pull out our ability to take steps to keep everybody around and alive until we get them vaccinated. This would be like getting into the fourth quarter and pulling two of your players off the court and going 3-on-5. I mean, none of us should want to do that. All right. So Kentuckians strongly, overwhelmingly support the steps we've taken. Second, we've been successful. Those steps work. Third, there are real concerns with what's actually in the bills and what they would cause. First, one of them writes CDC guidelines into law. And we've shown you before, but let's show you again, a letter from the director of the CDC, Dr. Robert Redfield. And he says that's a bad idea. We don't write the guidelines to be written into laws. It won't work. Well, if the head of the agency that you're trying to write into law says, don't do it, it won't work, surely we won't do it because it won't work. But here's the other thing. Do we want to give our rules over to a federal organization where no one is elected in it and we have zero accountability on what they decide to do and don't do? And I would say this, I think it was Santa Clara in California tried to do something like this earlier in the pandemic. They put out direct guidance to that county. So I would be careful in who you provide authority to, and can you give what would be lawmaking authority or rulemaking authority to, can you delegate that to a federal agency under Kentucky law? And I think that answer is no. The other challenge, and we showed this before, but again, to go over it again, is CDC guidance. There's a ton of it. I was thinking if I was a specific small business, and I found 3 detailed guidelines that could apply. I found one general business guideline, and then I found one for employees, and then I found one for people that would come in and get services and what we would potentially have to do there. And they weren't all consistent. They could be contradictory, written for different groups, but they're guidance, and that's why they can be a little bit contradictory. But the moment they become enforceable regulation, none of our businesses are going to know what the heck they're supposed to do or should do. And in fact, many of these say these are all requirements above and beyond everything your state has. So I guess they would rewrite the state rules in. But here are just a couple of examples of what this guidance would say. It would say you got to avoid crowds in places like restaurants, bars, fitness centers. That would mean apparently they could be open, but you couldn't go into one if other people were there. And this isn't being critical of the CDC. This is meant to give people advice that we then take and create the rules, not to be the rules themselves. So not only would it not work, it's going to cause chaos because no business is going to know what they can and can't do. And in addition to delegating kind of rulemaking to a federal government agency, it looks like they're also trying to delegate that authority to local chambers of commerce in a specific part of that bill. Again, not legal, and I don't think that this or any of the other two bills are constitutional either. So let's just look at that real quickly. All of these attempt to remove via legislation authority from the executive branch. Here's a quote from the last Supreme Court case where they upheld a governor's authority to respond to emergencies. And I'll let you read it for itself. And there are a lot of other quotes in this case, but I think this is the Kentucky Supreme Court trying to serve notice, not always directly, but that they believe responding to an emergency is executive in nature. So it falls under the executive separation of powers. And so trying to remove that from the governor, from the executive branch, we believe, and I believe that there are portions of this Supreme Court opinion that say would be unconstitutional. And, that Constitution was created for very specific reasons, one of which was to limit all branches, including the legislature. This is a way of saying under the Constitution, this is the executive branch's job. You're the commander in chief. Certainly, I hope we wouldn't think that in the middle of a war and of a battle, you would have a group that debated and voted on tactics, and then we'd have to change it. That's just not what the Constitution sets up. One last piece, and that's cost. So one of the specific bills would require if a state of emergency were going to extend beyond 30 days in certain situations, that we call the legislature back in every single time in a special session for them to extend the state of emergency. So a special session costs $65,000 a day. You have to have at least 5 days in a special session to pass the approval legislation, but any legislation. If this were in place during what we faced, we would have had to have 10 special sessions thus far, totaling $3.25 million in legislative salaries and reimbursing folks for their costs and for driving. It would also, in an emergency, transform a part-time legislature into a full-time legislature. In fact, it'd be pretty close between last year and this year, whether we would have, we'd come up on as many, maybe more days in special sessions than are allowed in regular sessions. And I'm not sure that that's something that we ought to be doing, nor is it something that I think is appropriate under the Constitution. So all of that is laid out, at least in part, in some of our veto messages. But like we said, we're going to see if there is common ground that doesn't violate the Constitution, that gives the flexibility we need for what appears to be a mutating virus. And we're certainly going to do our part, starting with a letter here in the next couple days about different options we think are going to be there. We vetoed a couple of other bills. One I'd mention is an attempt to remove a governor's ability, not just to reorganize boards, because we remember U of L board under the former governor or the Board of Education under me, but also would remove the ability for us to reorganize cabinets and offices, things that we're responsible for. And that's a concern because I have a duty to faithfully execute the law. So if the legislature passes a law, we're supposed to be able to execute it. But if we don't have the ability, if they pass a new task to have a unit that does that task, we can't do our job. But even more than that, so many federal grants that we want to compete for require, whether it's a new commission or new personnel or structure to do really good things, we'd have to call special sessions for potentially each and every one of those grants. So we're going to try to find a way forward there too that addresses the overall larger concerns, while it doesn't, intentionally hamstring the executive branch from doing its job by having to go to the General Assembly every time we want to combine two general counsel offices to save a little bit of money. All right, so that was a long time. We're 55 minutes in, but now we're to questions. So let's start with Karen Czar from WUKY.
Good afternoon, Governor and Virginia. Thank you. Two questions about boosters. The first is some states are reporting issues with getting enough supply they need in time, or people not coming in time to get that booster. Are we seeing that here? And then secondly, what is the window of opportunity? For example, you're at week 4, which is when you should get your booster, but is it you need to get it within a few days, or do you have a few weeks? Thank you.
We are not seeing those issues about not having the vaccine or people not signing up. You certainly have a window of time. We'd like to get it as soon after the 3-week or the 4-week period as we can, but certainly in that next week or as soon thereafter as you can get it is certainly what we would recommend. If you can't get there on the day, don't not go. Just get it as quickly as you can after that. We don't know how much immunity you have after the first shot because the study didn't do that, but you're going to have some. We just need you to get in for that second one to get up to that 95 or so percent. I followed the schedule. I got my booster shot this morning, and I know others are getting it here in the next couple of days, and I feel just fine. Shelby Smithson from WKYT.
Hi, Governor. With those lower numbers of doses sent by the federal government, is there concern about the supply we will have when the regional vaccine centers open up?
Yes, but it's concern about supply in general. When we look at going from 1A to 1B, the number of people increases significantly, and 1B to 1C, it increases dramatically. And we'll have enough to supply these centers, these regional centers and our other partners with some vaccine, but it's not going to nearly reach the capacity of those partners to get the vaccine out, much less all those other willing providers that want to. We need more supply of vaccines, and we're going to look at every option. Requested from Operation Warp Speed that they at least double the number of vaccines we're getting. We could get those out. I believe we already have the capacity to provide that amount now. We are also going to explore whether or not we can buy vaccine in addition to the federal program directly from manufacturers, something that I heard New York was going to look at. If they're going to look at it, we're going to look at it too. Anything we can do to get more supply, because people are ready. And I understand frustration when they can't get it. We're also going to have to look at how far out when we open up different scheduling we go. And that's what gives people more peace and helps with patience. Is it opening it up for a 2-week window and then once that's filled up, people have to get back online at a certain time for the next 2 weeks? Or do we schedule people out for 2 months so at least they have some idea about when they might get it? And then the challenge there is if we get some more supply, which would be great, how we move people up. That takes a pretty sophisticated IT system, and we got some good partners for that. Catherine Collins from WLEX. Okay, Debbie Yetter from the Courier-Journal.
Hey, Governor. Why isn't Kentucky getting as much vaccine as it expected or had projected? And what are prospects of getting an increase from Warp Speed?
So we are getting the amount of vaccine that, at least I believe, that corresponds with our percentage of the population. It's just nobody is getting as much vaccine as they need. We had certainly hoped that manufacturing would be ramping up at this point, and we would see more as each week proceeds. It looks like it's stabilizing. And we hope that's not the case because it's stabilizing at a number, I believe, below what we can vaccinate in a week right now, well below what our capacity to vaccinate is going to be next week and then the week after. And I don't think our state is alone in this. While I think we've ramped up operations well, maybe better than most, other states are going to catch up, and that's a good thing. We want to reach herd immunity. But the limitation is supply. We can only vaccinate as many people as we have supply. Tom Latek from Kentucky Today.
Good afternoon, Governor, and good afternoon to you, Virginia. When we go to 1C, which you mentioned is a significantly larger group, will there be a priority within 1C for those who are having some kind of pre-existing condition, as opposed to the healthy 60-year-olds, as opposed to the 20-year-old food service worker who's considered an essential? Will there be priorities within that category?
So there'll be some of our partners that will be able to do that, but for the major sites, taking that step, adding that complication, puts us back in the very beginning of this, when shots weren't getting in people's arms because of how complicated that it got. I read what somebody, I think, put out as a joke that we're now opening it up to people born on a Wednesday in the 4th month of the 3rd year of the, and what we've found and what we know is you have to open it up to a significant group of people. And that's what 1C is. And it's going to be available in most areas to everybody in that group at the same time. And that logistically, that's just how we have to do it. Who else? Who extra did we get? Okay. Melissa Patrick from Kentucky Health News.
Hi, Governor. So you referenced the challenges that they're having in Louisville already. What do you have to say to the many Kentuckians who are in these high-risk groups, 70 plus, who can't get access to the vaccine, especially when some programs, like the one at the University of Kentucky, is allowing people who are at much less risk to get vaccinated? What sort of words of can you offer that group?
Now, to them, I'd say we are moving as fast as we can. The priority that you're in are really important priorities. It's you, and looking out for your health and knowing that you are highly at risk to this virus. It's our educators, and I know each and every one of you, some of you are taking care of your grandkids that have been at home, and you want to get them back in school as much as everybody. That's why those educators are in that group with you, and first responders, those that you call on when you need help. Those are the groups that should be happening right now. Now, doing something like this isn't perfect, and there are going to be times where people skip the line to make sure we don't waste one of these. You are being prioritized, but our challenge is we're not getting enough. So asking you to be patient, I know is hard. You are highly at risk, but every single day we're working to try to get that vaccine to you, and we can do it as fast as the federal government will send us vaccine to get it done. Joe Ragusa from Spectrum.
Hi, Governor. So I have a couple questions regarding the bills you vetoed. The first one, just a quick rundown of the specific bills you vetoed. I've got a count of 5 so far that you've talked about, House Bills 1, 2, and 5, and Senate Bills 1 and 2. But also in that regard, as far as the talk of compromise with legislative leaders, how do you expect those talks to go? I imagine over the next couple of weeks before they return to session in February, and where do you see areas of compromise being taken shape?
The bills that we have vetoed should be up on the Secretary of State's website. That'll give you each one that we vetoed to date. There are still at least a couple more days to some of them, and then 1 or 2 were passed at a later date. My goal was we let them know today what was being vetoed before we did it. I'll be sending a letter talking about different areas that I believe that we can talk about here in the next day or so, so that we can have something on the table as we sit down. At least Senate President Stivers talked about wanting to potentially have those conversations. So I think that the proposals that we'll be able to make will preserve the ability to fight this virus and to continue our comparative success. And I call it comparative because people are still dying, but we're doing better than all our neighbors, which means less people are dying. But I don't want to jump up and down and talk about success when people are still dying. But we've got to be able to continue what's working, and we got to make sure we don't put something into law that doesn't work. And any legislation needs to be constitutional. But I think what you'll see is if consultation is the main gripe that we didn't consult enough, well, let's create formal requirements of what that looks like, and the timing that it has to occur during one of these. You know, another thing out there is that the Trump administration has had a declaration of emergency the entire time that we have. If there are some that think that ours is too long, I mean, the federal government has said it's this dire of an emergency. Maybe we look at things like that about what they're doing at that level. So on the board's issues, and I mean, certainly, hopefully we can reach a compromise where we still have the ability to seek efficiencies within the executive branch without calling a special session to do it. Because if I can save $300,000 by combining two offices, but it costs $300,000 to hold a special session, and I have to do it to save the $300,000 by combining two groups, I mean, come on, that's bad for the people of Kentucky. Corinne Boyer from WEKU.
Governor. The state says that all Tier 1 individuals, including 1C, can start signing up for the vaccines on February 1st. But in Louisville, for instance, that plan doesn't project 1C vaccinations until April or May. So what factors play into why some localities have a different rollout plan than what your team has outlined? And do you know when you might receive a reply from the federal government about your request for more vaccines?
I don't know when we'll receive it. Certainly, there's a change in administration, so I wouldn't expect it for at least a couple days as that new administration is coming on. Remind me the first part of that question, if you will, Corinne.
Can you hear me?
I can hear you.
Oh, okay. Sorry. Yeah, so I'm just wondering what the difference is for different localities. Like the state says that you can start signing up for vaccines on February 1st, but in Louisville, you can't sign up until April or May. So what's the difference between some localities and others?
So challenge is not just volume of vaccine to different areas of the state, but numbers of individuals that fall within those categories. I mean, the sheer number in Louisville of healthcare workers is higher than I believe its proportionate share of the population, even with so many systems that serve people all across the state. So we're going to be flexible, especially with areas that haven't been able to get through enough of 1B to help and to let them prioritize. But we've got to continue vaccinations all over the state. We can't pause them and just send everything to one area, though we do adjust the amount of vaccines going to different places. And with a logistical operation like this, where we want to set priorities, but speed of vaccination is what gets us to herd immunity. It's just not always going to be perfect. And that's tough on people, right? I mean, it's tough by saying, well, 2 counties over, somebody in my situation already got the vaccine. That's tough. But that's the type of patience we have to ask for to get to herd immunity as quickly as we can. But we're going to work, whether it's with Jefferson County or others, about where they are on their list. And in fact, we sought input before announcing the February 1st date. JCPS starting to be vaccinated this week, again, working with them, and they're right in the thick of timing of the rest of the state on that piece. All right, got a couple of written questions. 2 are on security at the Capitol. We do have heightened security through at least Wednesday. I'm not going to advise on what that is because I don't want to give the game plan to those who would cause terror in our Commonwealth. And as we see more and more people from Kentucky arrested for participating in an attack on our country, for being a part of a riot that stormed the U.S. Capitol, it's more important than ever that we call out hate and we call out insurrection And we call out domestic terror when it occurs around us, whether we know the person or not, maybe especially if we do. But I got to tell you, citizens are stepping up, are recognizing those actions for the terrorism that they were, and they are reporting in off pictures, those that have been there. So I appreciate that patriotic duty. But the patriotic duty we all have to exhibit going forward is this is our country. And we're not going to let people attack it, whether it's foreign or domestic. We care about this country. We might not always get what we want in elections, but we care about the country. And we are going to ensure that our democracy survives and thrives. Robertson County in northern Kentucky is showing up green. Is going to be yellow here, I think, this week. The answer is the population is so small that the number of tests can be so small that can change in a day or so. It's a wonderful community, but compared to many other communities across Kentucky, it just has fewer people. Child care providers have signed on to get COVID vaccine during 1B at the same time as teachers. I believe that they are currently in 1C, which is going to start here in just a couple of weeks. So help is on the way. What's really going to set that timing is how much vaccine we get. I'm trying everything I can to get us more vaccine. A newly elected Eastern Kentucky public official who attended the January 6 DC rally turned riot announced at a city meeting that she will not apologize nor resign, as it was her right as a private citizen to attend. Do I think that the commissioner should resign her post? I think she should, in the very least, condemn what happened, condemn that type of violence, condemn these theories out there that try to dehumanize other people, accusing people of being a part of a pedophilia ring with absolutely no evidence, and it's ludicrous. But the reason you do it is to dehumanize someone else so that you can hate or even hurt them. We've seen it throughout history, and it's wrong. And the fact that it's being perpetuated on our shores by our people is further wrong. And if we have an elected official that was there, they ought to come out condemning every single piece of it. Condemn the QAnon part, condemn the rally turned riot, turned domestic terror attack, condemn these militias that talk about overthrow of our government. Condemn it all. If you are a part of government, I mean, they're coming for you too. But I mean, as an American right now, we need you now more than ever. Where do I stand on SB 56? We'll provide a written response to that to Louisville Business First. If you only have, this is about, I'll go ahead and answer it. It would limit Medicaid MCOs. Those are the people that provide the management now, the companies, to 3. We have had in our history of having MCOs, 1 quit. And if we only had 3 and 1 quit, people, a huge number of people would be without service and would be in a very difficult spot that could be the difference between life and death. I know there's frustration in that we awarded 5 and another sued, and there's a court order making them the 6th for now. I can get that causes frustration, but I don't think that we limit something by legislation when the needs that can change, the numbers of people that can be involved, the services that can be provided should be what helps us make the decisions. But I understand the frustration of the individuals that filed that bill. All right, today was really long, but I hope what you take out of today is we are making huge strides in our ability to vaccinate. Supply is now going to be our limiting factor, which is squarely on the federal government. You heard Dr. Stack say that right now we could provide 250,000 vaccinations a week, and we're getting 50,000, 25% of that. So actually, my math there was not good, but not what we need to make sure that we can get people vaccinated as quickly as possible. Also, really important that we continue to have the ability and the fluidity and the flexibility to fight this virus, knowing an overwhelming percentage of Kentuckians agree with us. But I'm always going to work to see if we can discuss and come to resolutions with people. But I'm always going to fight to do what's right and make sure that we have the tools to protect each and every one of you out there. So I haven't said it this time, but we are going to get through this. We're going to get through it together. We're going to get everybody vaccinated. We're going to get to a point where we can get back to seeing people when we want to being able to be close to people when we want to. That future is right around the corner. We just got to fight until we can get there. Thank you all. We'll see you Thursday at 4.